I was born 3 months early at 1 pound 6 ounces, and growing up I got the chance to meet the different health professionals that took care of me. And from meeting those different people throughout life growing up, I realized that I wanted to have that same impact on patients. I don't need them to know my name or to remember me, but just know that during a hard time or a rough time that there was someone who took care of them.
So I actually had a teacher my sophomore year of high school, and I took a career education class where we got to research different careers, and I actually knew her outside of high school, and we went to the same church, so we kind of had a personal relationship. And we got to just talking, and she's like, I think you'd be a great nurse. And I was like, never thought of that before. And then later on in my high school career, I took a CNA class and got to shadow in hospitals, and I just loved it. And I knew that as long as I liked being a CNA, that would probably be a good precursor to being a nurse, and I've loved it ever since. The onboarding process was, I think, almost a week and a half to 2 weeks. So that was really helpful. We did lots of scenarios, before I even stepped on the floor. And then my orientation on STICU was 6 months. So as a new grad in an ICU, I felt like I had adequate time to learn and figure out the skills that I needed to have in order to take care of those really sick patients.
Parkview culture, especially at Randalia, is a family. I don't feel like just a number here at Parkview. We're all working towards the same goal. And something that I didn't realize coming right out of school is that I would have interactions with SCORE or like this cleaning staff, or respiratory therapy or PTOT or speech, and just how everyone comes together to make sure that that patient's care is great and amazing. And I think some of the funniest and coolest interactions that I've had with my coworkers are people that aren't nurses, people who aren't doctors.
All of our coworkers are really great. They are really encouraging. They're always there to help and ask questions. So I think knowing that if I don't know the answer, I have somebody who does. So that helps me be confident in doing what I know how to do, but then also having someone to fall back on if I don't.
Since we've been so far into the pandemic, everything's kind of become normalized with the PPE, testing patients, like it's just part of the regular flow of things. I'm not scared. I feel very protected here at Parkview, and very prepared to do my job on the daily basis.
But as we've continued through the pandemic, we have really good support from our coworkers and just everybody in the Parkview system, and it's been easier as it goes on. Seeing people struggling and hurting and sick isn't easy, but the whole process has become easier, and we know how to take care of the patients a lot better.
Because I work on English Progressive, we get patients who get worse from the floor, patients who are getting better from the ICU. So it's interesting to always be in that revolving door, but it's hard to see the patients that are declining, some of the older patients, and just having that conversation multiple times, not only with them if they're learn-oriented, but with their family members, of making that hard decision. And because they're not allowed to have visitors, this could be one of the last conversations that that family member has with that patient, because the next step for them, if they're full code, is to get ventilated, and sometimes patients don't make it off the vent. So that's been pretty surreal, to be like the middleman in between two loved ones, and to understand because of COVID they may not be able to see each other again.
It definitely is a struggle at times, but you know that you're helping the patient as much as you can, but then you're also helping the family if the patient does pass.
When times get hard or things get rough, or you get into new or different situations, like these are the moments that you dreamed of. Not everything is happy, not everything is joyous. There obviously are moments in nursing where it is that, but life is real, and I'm just so thankful and grateful for the place and space that I'm in. I'm really happy with where I am here at Parkview, and I couldn't ask for more. All my dreams are coming true here at Parkview.